Hello, this is Dr. Lucasz Kowalczyk, founder and CEO of ProSketch. Welcome back to our ongoing series, COVID-19, Your Readiness and Action Plan. If you haven't had a chance to read our previous articles, please click the link below. I hope you'll get a lot of useful information out of them. In this week's article, we're going to be looking at how to optimize your surgical scheduling in the area of COVID-19. In particular, we'll be looking at how you can do this through the lens of optimized staffing in your surgical scheduling department. Before I get too far into this week's article, I just want to extend a huge thank you to our incredible frontline healthcare workers and staff battling COVID-19. Through your efforts, many parts of the United States have seen decreases in the new rates of infection with COVID-19. Patients are starting to leave the hospital, they're starting to come off ventilators, and your communities are becoming safer and healthier places to live. Thank you so much for all that you've done. Your efforts are making a tremendous difference. Please keep up the great work. So, as stated, this week's article is going to deal with how to get the most out of your staffing in surgical scheduling. First, a little disclaimer. Please make sure to consult legal counsel to make sure your surgical scheduling process is in compliance with the new CMS guidelines published on April 19th and your local state guidelines for scheduling elective surgical procedures. With that, let me jump into a quick overview of what we'll cover in this article. We'll be discussing the resources that you're using to schedule your cases at your ambulatory surgical center. The place we'll start with is a nurse scheduler or an RN scheduler and seeing, can you make the transition from an RN-based surgical scheduler to a non-RN based surgical scheduler? The obvious advantage being a huge savings on cost on the operational level. Now, that transition can't come with compromised clinical quality and scheduling. So we'll address all the pitfalls of surgical scheduling. Additionally, we'll also talk about if you are using a non-RN based surgical scheduler, can you amplify their efficiency to get you better and higher quality results? So the pitfalls of surgical scheduling that we'll address include appropriate location selection for your patients, ASC versus hospital, the appropriate management of medications around the surgical scheduling process, including anticoagulants, anti-diabetic medications, and medications such as bowel preparations, when to start and stop all of those medications in the surgical scheduling process. Then we'll also deal with the various stakeholders that a scheduler needs to deal with in order to successfully get a patient to their appointment. And we'll deal with anesthesia, cardiology, your insurance department, and even the operating physician themselves. All of these stakeholders need to be managed in order to successfully schedule certain patients for their procedures. And finally, we're going to deal with the patient themselves and how you can synthesize this entire process into a set of clear and concise instructions for your patients in order to maximize their probability of making it to their procedure without any hiccups or cancellation. We'll address one of the main reasons of using a nurse in the scheduling process, and that's increasing medical complexity. Your scheduling department is dealing with an increasingly aging patient population. And with increased age comes increased medical complexity. Your patient population has higher rates of heart disease, diabetes, obesity, sleep apnea, and COPD, and higher rates of medications for those conditions, including anticoagulants and anti-diabetic medications, all of which can affect the probability of your patients making it to their procedures without any hiccups or cancellations. Our company ProSketch looks to create this type of a system that mitigates the pitfalls of the surgical scheduling process that we discussed today. We want to supercharge your surgical schedulers with clarity and accuracy in the scheduling process and provide your patients with unparalleled personalization and clarity of instructions. So please go ahead, jump into the article. I hope you get a lot of useful information out of it. And please don't forget to consult your legal counsel to make sure you're in full compliance with federal and state laws. And as always, thank you so much for continuing to provide incredible healthcare in your community to help keep your community as safe and healthy as possible. We look forward to continuing the discussion with you via our website or LinkedIn. Post comments and feedback. We love to hear from you. And as always, thank you so much and keep up the great work.